topic is arthritis. Arthritis is the inflammation of the joints. Introduction. Arthritis is a Greek word, arthro, which means joint inflammation. Arthritis literally means joint inflammation. Arthritis is a breakdown of bone tissues. Arthritis leads to decreased motion and muscle weakness. Definition. Arthritis is defined as inflammation of the joints characterized by pain, swelling and limitation of joint movements is called arthritis. According to WHO, incidence, arthritis affects more than 180 million people in India. The United States are affected to the arthritis. 53.2% millions people in adults are affected. Next one, etiology. Etiology means causes like muscle weakness, being overweight, degeneration of joints, abnormal metabolism, infections, injuries, accidents, immune system dysfunction. Classification, there are 5 types: osteoarthritis, infection arthritis, rheumatoid arthritis, gout arthritis, juvenile rheumatoid arthritis. Osteoarthritis, it is affected to the older than 45 age women, more affected in the ends of the fingers, thumbs, knees and lower back and hips are affected. Next one, infection arthritis, also known as septic arthritis, spread to one or more joints and cause of inflammation. Rheumatoid arthritis, inflammation of the synovial membranes of affected joints, increase motility and morbidity. Gout arthritis, it is a Latin word due to excessive uric acid in blood. Juvenile rheumatoid arthritis, it is a chronic disease in children, mostly affected in the childhood. Pathophysiology, due to ecological factors of aging that leads to chondrocyte failures, that leads to irreversible matrix degeneration, that leads to microfractures like small fractures, that leads to inflammation, that leads to metalloproteinase increase, that leads to cartilage breakdown, that leads to arthritis. Next one, clinical manifestations like pain, swelling, tenderness, loss of function, stiffness, deformity, weakness, erythema, instability. Next one, diagnostic evaluations. Main first one, history collection, physical examination, radiology, ultrasound, MRI. MRI means magnetic resonance imaging, blood culture, X-ray, CBC. CBC means complete blood count, ESA test, erythrocyte sedimentation rate. Complications like swelling, loss of mobility, weight gain, sleep problems, fatigue, stiffness, metabolic disorders, increased risk of falls. Management, there are 3 types: medical, surgical, nursing. Medical management, non-steroid anti-inflammatory drugs are provided like paracetamol, diclofenac, aceclofenac, ibuprofen. Steroids like injectable glucocorticoids. Opioids like tramadol. Immunosuppressive and cytotoxic drugs like methotrexate, leflunomide. Surgical management like osteotomy. Osteotomy is the distribution in the joints. Viscosupplementation like reconstruction of synovial fluid. Nursing management, to provide the care, assess the patient general condition, monitor vitals, provide the comfortable position to the patient, administer the medication through the doctor prescription. Teach the cold and hot application, maintain the nutritional diet for patient, encourage the patient yoga and relaxation of breathing exercise to provide the psychological support. Next one, prevention. Maintain the healthy weight, avoid high impact exercise, avoid alcohol, intake to the plenty of water, take healthy diet, balanced, for example calcium saturated fats, having the good sleep, being physically active, reduce the stress and joints. Health education. Health education like take medications regularly, don't avoid, exercise regularly, control the weight, maintain rich amount of diet. Example like calcium, protein, vitamins. Apply the heat the site of joints. Physical therapy to take the plenty of water. Thank you so much.